Recording in progress. Hello and welcome to our Friday webinar. We have a new person today. I am so excited and a very special guest. Welcome, Dr. Natalie Antinoff. Thank you for joining us.
Hi, so glad to be here.
And my gosh, I just want to wait for people to log in because this is actually, this topic is really, I mean, I can just tell that it's something that people either know a lot about or know very little about or somewhere in between, because we got a lot of people joining us. So this is a good, this is exciting. It's been a while since we've seen each other. Back in my bird talk, going back to my bird talk days, it might have been at, I'm trying to guess, like a Dr. Rich conference in Louisiana, or maybe in Mississippi at but I know I remember spending time with you there, and that was really, I mean, I remember we went out to like a group dinner with all the speakers, and I was just an attendee, but I remember meeting you there, and I was like, oh, I like her. So I'm really glad to see you back. It's been a while. So
I'm flattered. Thank you.
and this is my favorite part of when we do our webinars too, is I like to, when people log in, they say where they're coming from. So we can see that we get people from all over. Yeah, so everyone's like saying hello from where they're joining us from. And so with that, so well, we'll have you do a little intro just an intro background. But the topic today, I haven't even mentioned what the topic. I'm gonna say it wrong. If I think about it,
Atherosclerosis.
Atherosclerosis in pet birds. Okay, there we go. I could probably spell it better than I could say it, but yeah. So okay, there we go. We got people from Canada, we got people from Minnesota. Yeah, and I know you have a wonderful PowerPoint presentation for us. So when we get started, I'll just remind everybody that if you have a question, we'll try to get to it at the end of the webinar. And so save questions for the end, but you can type them in the Q&A button as you think of them, and then we'll pull some questions to answer at the end. And if we don't get to your question, we'll try to get an answer later. But also, don't use the chat feature for the questions. Use the Q&A button. And okay, so there, I just said a mouthful. I'm going to let you. So I'm going to let you get started here. And I know you have a presentation, so and a little bit about you, since you're new. This is so exciting to have. I love when we have new speakers, and you're one that I know has been on our radar for a while. So we're so happy to have you with us today.
Well, thank you. I'm so happy to be here. So just a little bit about me. I graduated from vet school from the University of Wisconsin a long time ago. We won't say how many years ago. And then I did an internship, and I did a small animal medicine and surgery internship. And then I did a residency in avian and exotic pet medicine and surgery. And then after that, I moved to Houston, Texas, and started Gulf Coast Avian and Exotics, which at the time was the first exotic practice in a referral center. I was there for 22 years, and then I have moved on to a couple places since there, and I've landed at Texas Avian and Exotic Hospital in just right outside of Dallas, Texas, which is where I am, and I'm the medical director there. I have over the years had many interns, and now we're training and graduating residents. And I love teaching, I love speaking, and I love practicing and working with exotic pets. So.
Oh, that's great. And Texas, if I remember correctly, Texas is one of a lot of bird clients in Texas, I imagine.
A lot of bird clients, a lot of bird breeders, a lot of aviaries. Yeah, it's a really good environment for it, because the birds can be outside for so much of the year.
Nice.
And the more we learn, the more we know that being outside is so beneficial for them. I don't even think we realized it until Dr. Eccles started some of his work on that a few years ago. So
that's right. That's right. Why the weather is nice, and
yes. Yep.
Has it hit fall yet in your area, or winter, or where are you? Where's Texas?
We had one cool day where it actually stayed in like the 60s and 70s yesterday, and now it's back into the 80s today.
Yeah.
Yeah.
All right. Wow. Okay. We have people from all over. This is exciting. Love seeing this. Okay. So you have a wonderful, I love PowerPoint because it helps us absorb the information, and we can go back and rewatch it and learn it even better. So thank you for putting this together. This will be very, very helpful.
Now I just have to get my screen to share again. So hang on one sec.
No worries.
Share screen. Oh, come on. You knew this would happen. Let me do that.
Oh, they got people from all over the world: Canada, Poland, Minnesota, California. That's where I am. And then Pennsylvania, Monterey.
All
Yeah,
right, here we go.
there we go.
Are
All
you
right.
seeing it? Are you seeing the
Yep,
screen?
I do.
All right. Are you guys ready?
Yes, 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 yes.
Okay, here we go. And again, thank you so much to you for all the hard work you've put into Brenda, to the Lafeber company for inviting me to be out here. I really love, or out here or in here. I really love it.
Virtually. Yeah.
Okay, virtually, yes. All right, I just have to find my pointer here. Give me one sec. Okay, so we're going to talk today about atherosclerosis in the aging pet bird. And don't feel bad for having difficulty pronouncing it because I still stumble over it sometimes, especially when I'm tired. Okay, so the first thing that we need to do today is define what is a senior bird, what is an old bird, because I think that it's not so much that there's misinformation out there, but there's kind of misunderstanding of the information that exists. So when you guys read published lifespans, you'll see that like Amazon parrots can live to be 100 or more, and that macaws can live to be 80. And that's true, but I feel like it's actually kind of like saying a person can live to be 110. That's not a lie. It's very true. We certainly have documented people living to be 110, 112. But I think we get into our heads that that's the norm and that that's the expectation for all of our birds. And that's not really true. And I think that that kind of creates a false sense of when your birds are seniors. So I would say it's probably more accurate, at least for me, from the medical standpoint, when do I think about birds being senior? And these are, I think, more realistic life spans and life expectancies, where we're looking at averages, which like in a person is probably now, I don't know, somewhere in their 80s is a life expectancy. You know, what you see online is like the longest recorded, and that's not necessarily, you know, what we should be basing that on. So I put up some lifespans for you guys, and the three I want to really point out is Amazon parrots, 50 to 80, macaws 40 to 50, and African greys like 30 to 50. So what does that mean? Well, let's think back to humans. Like when you're a person and you turn about 40, your doctor's going to start recommending that you do blood work every year, you get different tests, you get more tests, you get checked out more frequently. And so I tell people that, you know, we don't want to wait until your African gray is 30 years old to start doing our senior workups. I like to start doing senior workups when they're in their very early 20s in my African gray patients, because that's when we really want to start looking for senior diseases and start to like evaluate and maybe pick things up before they become problems. So now we're going to get to the heart of the matter. And anybody that's ever been to my talks, you know that I like to give little anatomy lessons. So you're going to get a little bit of heart anatomy.
Sorry, can I just ask, I'm seeing a double screen. Is there a way, because the information looks so important and it's small on my screen. Is there a way that you to make it like a single slide?
You're seeing, what do you mean you're seeing a double screen?
I see two slides. I see the slide that you're on and I see the next slide. So
oh, are you seeing the, okay.
Yeah.
Okay, hang on a sec. I can fix that.
Okay, cool. We had it
Let
right.
me,
Yeah, the preset. So whatever you did. Yeah. Oh wait, we're almost there. Just for sure.
okay, wait, I can do this. Hang on, I can.
My eyes are good, but
Yeah.
not that. But I look like yeah, definitely want to see the there we go. Thank you.
Is
Yeah.
that better? Okay, thank you.
Perfect.
Yeah, thank you. Sorry. Okay, so what you're looking at here. So let me go back to the last slide just so you guys can see it the way it was supposed to be seen. Oops. There you go. Okay, is that better for everybody?
Yep.
Put that up there real quick. So here's your anatomy lesson. So here you're seeing, basically you're seeing a bird heart, and the view on your left, what you're seeing is the bird heart as if the bird was laying on its back and you just lifted up the keel and looked inside. So can you see my pointer moving here?
Yes.
Okay. So what you're seeing, I don't want you to get caught up in the words. That's not really the purpose of this talk, but the avian heart has 4 chambers, just like ours does. It has a left atrium and a right atrium, and a left ventricle and a right ventricle. But what's different is you have the vessels coming off of the heart are a little bit different, because in people, we just have this aorta coming off right here. And in birds, you get this aorta, and then it very quickly splits into what's called the brachiocephalic trunk. And it splits into 2, the left and the right. So here's the right, here's the left. And it's not so much that I care if you know it, but I'm going to point to it a couple of times in this talk. So I wanted to show you what it looks like before we get into the diagnostic part. The second view here is if you were to look at the back of the heart. So if you like laid the bird on its keel and you kind of lifted up the back off of it and looked down at the heart. And here's the same heart, the left ventricle, the right ventricle, you kind of, it's not such a clear distinction when you don't have this nice dotted line there, right atrium and left atrium. And then the blood that's going out, this is that same brachiocephalic trunk, two brachiocephalic trunks and the aorta. And then purple or blue in the next couple of slides is going to be the vessels that are coming back in. And the reason they're blue is because they come back in with blood that doesn't have oxygen. In other words, the red blood vessels have all the oxygen from the lungs that the heart is pumping to the different parts of the body. Body takes that oxygen, and then the low oxygen or lack of oxygen blood comes back in through the cranial and caudal vena cava and the pulmonary arteries. Okay. All right, let's look inside. So the outside of the heart. So let's look inside. And again, don't get too caught up in this. I just want you guys to look at the big picture. The red is blood that has oxygen, and blue is blood that doesn't, or that has already given off its oxygen. So you can see it down here, deoxygenated blood. So what happens is, and I think you can see it better on this diagram and understand it better, is blood comes in from the body through the right atrium into the right ventricle, and then it has no oxygen or low oxygen. It never has no oxygen. And then it gets pumped to the lungs. The heart pumps it into the lungs where it gets its oxygen supply. Then it comes back from the lungs with its fresh oxygen, and the heart then pumps it out to the body where it then delivers its oxygen, and then it all comes back in from the body back into the heart to go to the lungs, get oxygen, and continue that cycle. So that's how the heart works, basically. Same with the human heart. Those of you that are sensitive or maybe don't want to see necropsy pictures, I've got like 2 or 3 of them in here, so you'll see these sensitive picture alerts come up. So if you do want to avert your eyes, if it's going to gross you out or make you queasy, just look away for the next like 1 or 2 slides. Okay, so this is from the Spear Avian Medicine textbook. And this is dissection of the great vessels of 2 birds. The left is a cockatoo and the right is a chicken. And just to show you what this looks like, and look on here on the left first, this is like a live view of what you just saw. And I just want to point out the heart. It's not really purple. The authors actually say this is from Euthanasia Solution, this artifact here. It's not really that black color. But here's the brachiocephalic trunk that we talked about. And there's the other brachiocephalic trunk. You can't see the aorta really, really well here. And then this is the trachea that you're looking at. I want you to have these anatomic references. And then we zoom in a little bit more in this chicken. And here, this yellow is all fat. This was apparently a fat chicken, and that's not uncommon. Here's the trachea coming down again. This is the aorta, and then you can see these 2 slightly smaller vessels, which are the brachiocephalic vessels, the left and right brachiocephalic trunk. So just to give you an idea, that is your vascular and heart blood vessel lesson, because these are important. So when we have diseases of the heart, you can have disease of the heart, which is what we just talked about, or you can have disease of the vessels. So heart disease is an actual disease of the heart. I'm going to talk for a second about that. But atherosclerosis is a disease of the blood vessels, because the blood vessels don't stop here. They go and they supply all the rest of the body. And not that it really matters here. I just wanted you to see the blood vessels. But if you're wondering what this is depicting, this is a bird. It's depicting the lungs, the liver, and the kidneys here. So that's just for you. Don't, again, just get a sense, just to remind everybody that we do have blood vessels, and either of these or both of these can cause high blood pressure. So when we have heart disease, we can have diseases of the chamber, which are these parts, the parts that are in pink and blue. You can have diseases of the valves, which are, usually we hear that as a heart murmur. It's when the valves aren't closing properly and we get backflow of blood. or you can have diseases of the muscle, which is this part of the heart. It's the actual muscles that cause the heart to beat and contract. Okay, most of what we're talking about today is actually diseases of the blood vessels, but they can affect more than anything the vessel or the muscle, because there's a blood supply that supplies the muscles of the heart and help the heart to work. Okay, you thought you were done with your anatomy lesson, but you're going to now get a radiology lesson. You're going to get some x-rays. So when I look at the heart and lungs on the x-ray of a bird, and this is a bird, the head's up here, the tail is, oops, I forgot to start something. The tail is back here. These are the wings and these are the legs. And so you're going to see that a few times. And this shadow here is supposed to be a nice little hourglass. This is the shadow of the heart. And then this is the shadow of the liver. And that liver, I always teach people, if we were to draw an imaginary line from the shoulder to the hip, that heart and liver should fall within those lines. So there's our liver. And this is that, whoops, that's that hourglass that I talked to you about. We talk about this cardiohepatic waist. So it should have that nice hourglass shape between the two of them. And then when I look on the other view, this is called the lateral view, and the head is over here on your left. The wings are pulled back and the legs are down. And when I look here, here's the heart. Okay. Here's that brachiocephalic trunk that we talked about. Here's the aorta going all the way back, and then the pulmonary arteries and pulmonary veins coming back in, going into the heart and back out to the lungs. And then that liver sits just behind the heart right there. Okay, so these are what we're looking at when we're looking at our x-rays. These are our two standard views. So how do we use these when there's a problem? Well, for one thing, we can often see that brachiocephalic trunk that we talked about, but there's an actual formula, and this is for any vets that are out there. And if you're a lay person and you want to do this, you can. There's an actual formula that tells us that if we measure the heart at its widest diameter, and then I measure the keel, the chest cavity at its widest diameter, then the heart ratio, if I divide those two, the heart ratio should be within 51 to 60% of that length. And this is a formula that I use quite a lot to evaluate heart size and just double check and make sure that it's in that range. So there's actual science that our veterinarians are using to evaluate, like, is the heart big? It's not in this case. There's another formula you might hear about where you take this dark green line and then you compare it to the length of the keel, but that's on the actual bird, not on the x-ray. So I don't like that as much because then I have to handle the bird to do the measurements, and I like to do it this way. Sometimes we'll get a big fat liver. Here's just an example. So you can see we don't have that nice hourglass shape anymore. We have this big fat liver here. Whoops. It doesn't fit in those lines that we drew. The heart still does, but the liver doesn't. And it doesn't have that nice hourglass shape. And so what I can do is sometimes I will give barium contrast to see, like, what's actually big. Is it the liver? Is it the kidneys? Is it the heart? Because everything's like a big blob without it. So this is just how we use barium contrast. So this is just your little x-ray lesson for today. What you're seeing, the barium is the white, and we've given that into the crop up here, and it just moves through the intestines. And I don't really care about the intestines themselves, but I can see that heart looks okay, but the liver is really, really big, and everything else is pushed away from, remember where the liver is supposed to live is down here, and it's taking up all this space over here. Why do I care about the liver and if it's big? Well, there's lots of liver diseases and lots of reasons, but sometimes when a bird goes into actual heart failure, we'll see changes in the liver because there's backflow and pressure. So this is actually an ultrasound of looking at a liver. This is the liver, and it doesn't look very solid. It looks very solid, but see how it's not uniform gray? I know it's just shades of gray, but this black around it is fluid around the liver, and that's not normal, and that shouldn't be there. So that's one of the things that I do with ultrasound. We can also use ultrasound to look at the heart itself, and these are some images that I have, I think, from my time at Gulf Coast. This is the right ventricle and the right atrium, left ventricle, left atrium. And you can see here in a slightly different view, what we're doing with these X's and this 1 and 2 here is we're actually measuring these chambers. This is a skill that mostly cardiologists can do. Like, I'm not very good at this. Hearts are kind of a whole different entity. Like, I think I'm personally really good at ultrasounding birds, but I don't think I'm very good at ultrasounding bird hearts. It's really like a trained veterinary cardiologist would be doing that. So can we see the vessels on ultrasound? No. Maybe the very beginning of the aorta and the brachiocephalic trunk, but we can't really see them very well. But we can see changes in the heart that correlate with atherosclerosis. So this is another tool that we have to look at it. So what is atherosclerosis? Let's get to the meat of things. Remember we said earlier that you can have diseases of the heart or you can have diseases of the vessels, and either one of these can lead to high blood pressure. Atherosclerosis is actually a disease that happens in the vessels. And so it really happens anywhere in any of these arteries. It can happen in any of these arteries anywhere in the body. Okay, so you just start thinking about that. The definition is a buildup of fats, cholesterol, and other substances on and in the artery walls. And when you get these buildups of fats and cholesterols, it causes narrowing of the arteries. And so it blocks blood flow, meaning that all that blood that's carrying oxygen that it just got from the lungs can't be delivered as quickly and effectively. And so you get what's called a hypoxic state, where we're not getting enough oxygen to some of the vessels. Okay, let's see what that looks like. Oh, you may also hear the term arteriosclerosis, and I actually in my early career didn't know what the difference was, so I put it up here for you, because sometimes we use these terms interchangeably. Arteriosclerosis refers to, and this is all from like the Mayo Clinic and some human medical terminology. Arteriosclerosis is any hardening or loss of elasticity of medium or large arteries. If I were to describe what an artery should feel like, it should be soft and pliable, kind of like a nice thick rubber band. It should be that pliable. So anytime that you have a change in that pliability, anything that affects that is called arteriosclerosis. See, I'm stumbling on the word myself. Atherosclerosis is a type of arteriosclerosis that is hardening of the arteries specifically due to these atherosclerotic plaques. So this is looking at an artery kind of end on here, and this is different stages of development and progression of these plaques that form in the inside of these vessels. And you can imagine that once you start getting these plaques, you're narrowing this lumen, you're narrowing this diameter, so not as much blood can go through, and that can get worse and worse and worse. And then in humans, you form these blood clots that break off and cause strokes. The blood clots don't break off quite as much in birds. It's not as much of a common phenomenon. And then over here is just like you're looking at this lengthwise, and you can see how it just narrows the, like this, they're showing coronary artery, but it could be any artery, and it narrows the blood flow. So the plaques are yellow and blood is red. So even if we're using the term interchangeably with birds, what they get is atherosclerosis. There's actually 7 described stages in humans, and these stages do exist in birds. They're a little harder to categorize. We can categorize them with the CAT scan, but I didn't really want to go into that level of detail here. Just know that like in the advanced stages, and you can look these up in humans, they think it's like stage 4 to 7 is considered very severe atherosclerosis in humans. So what's happening inside these vessels, and this is for the veterinarians and any other medical people out there, LDL cholesterol is one of the bad cholesterols, and it leads an accumulation of this LDL cholesterol leads to free radical oxidation. Free radicals are bad. We don't like them in our bodies. And so the body calls on these types of cells called macrophages and T lymphocytes, which are the cleanup cells. So they go in to try to repair that damage from the free radical oxidation in the blood vessels, but they're not really effective. So then as these cells rupture, creates more inflammation, which then tells the body to stimulate more, send more macrophages and more T lymphocytes. So then it becomes this whole self-perpetuating cycle of adding on to that plaque. But the most interesting thing to me, at least, when I started reading and doing more of a deep dive into this, was that in humans, this starts as young adults. So these people that are developing atherosclerosis in their 60s and 70s, it probably didn't start in their 60s and 70s. It may have started as young as their 20s. Did you guys know, if any of you have kids, you probably do know that they actually now start screening children for their cholesterol levels at really young, like 4 or 5 years of age. They start looking at cholesterol levels in kids because we really want to identify the predisposition for this and address it at a young age so that you can prevent this process from going on and on and on in adulthood. Okay, graphic slide next. People that are sensitive, look away for a slide or two. Okay, this is a heart of a bird. I'm not sure what kind of bird this was that died of atherosclerosis. So what I want to point out to you is what looks different from those images that you saw before. A couple of things. This heart, you see this kind of whitish looking membrane over it? That membrane is called the pericardium. It exists in all hearts. It was probably in the hearts that you saw in the graphic pictures that I showed before, but it's called the pericardium, and it's supposed to be completely clear. It's not noticeable. It's a little membrane that should be as clear as cellophane, and it coats the heart. It coats all the organs. Each organ has their own little membrane around it. Makes it like slide more easily and move more easily in the body. It's not really an important structure until it gets discolored and abnormal. And you see how it's kind of whitish here and it's not really transparent. And that is probably because there's been chronic heart disease and or fluid that has been in that area. But the other thing you can notice is these blood vessels are super, super, super yellow. They're really hard. And if you follow them, this is the brachiocephalic trunk. And if you follow it, you see that all of a sudden here, it's clearer again. It's not so yellow. And here, it's not so yellow anymore. These are atherosclerotic plaques that you can actually see. And if you could feel them, they would feel more like a Teflon straw than they would a rubber band. This is not a blood vessel, by the way. This is a nerve. So I don't want you guys to get caught up in that thing on the stomach.
Wow.
One more growth slide. This is an old picture, so it's not great quality, but what this was the heart of a bird that had atherosclerosis, and I just kind of stood it up, and you can actually see your anatomy lesson. Here's the aorta, and here's the left and right brachiocephalic trunks coming off of it, and what you should notice is that they're just standing up there on their own. That is absolutely not normal. These should be floppy. Remember I said they should be like rubber bands. Rubber bands don't stand up on their own. These are so atherosclerotic that they are like straws and they are just standing up on their own straight out of the body. Okay, people that have looked away, you can look back now. No more gross stuff. Okay, so what are the predisposing factors? Well, we know a bunch of them in humans. We know that obesity, lack of exercise, high blood pressure, high LDL cholesterol, particularly sedentary lifestyle, diabetes, kidney disease, and then genetics. And genetics is a biggie. So what about in birds? What are these predisposing factors? We do see more of it in females than males, probably because the females naturally develop a higher level of fats and cholesterols as they are forming eggs. So reproductively active females may have a predisposition. We're not really sure. Species. The species that are more genetically predisposed than others that we know of are Quakers, Amazons, African greys, and macaws. But that does not mean it can't happen in other species. I've seen it in many species of birds. Genetics, diet, obesity, a sedentary lifestyle, chronic inflammation, and past inflammation. Remember, we talked about that inflammatory cascade that happens even in humans. So there's a lot of things that are very, very similar. And if you look at these lists, there are a few things that we can't control, like genetics, the species, probably not reproductive activity so much. Can we control chronic inflammation? Yeah, maybe to an extent. If we recognize it, maybe we can treat it earlier and sooner. But we can address diet, obesity, lack of exercise, and so we can really work on some of these factors. Same as in people, we think of heart disease and atherosclerosis in particular as a disease of, older people. And then you hear about the basketball player who's completely healthy, who drops dead on the basketball court at age 22. So those are the ones that have that genetic predisposition. Symptoms in humans, and this was actually taken from the Mayo Clinic website. And I want you guys to think about it. In the heart, if you have atherosclerosis or these plaques or lack of oxygen in the arteries that supply the heart, remember the heart muscle that we talked about? We call it angina, chest pain. In the brain, this is where you hear about maybe numbness or weakness of both arms and legs, but trouble speaking, slurred speech, and loss of vision. And then you've probably heard of a TIA or transient ischemic attack. So similar to a stroke. And in humans, these plaques can break off and cause a stroke. These episodes are different than strokes because they are not usually permanent, whereas a stroke is an actual clot of blood or plaque that permanently damages that vessel, which is why sometimes stroke victims don't recover use of one arm or use of one leg, because those are more permanent. We don't really see that so much in birds. If you have your atherosclerotic lesions in the vessels that supply the arms and legs, people get leg pain, numbness. We get weaker pulses in one leg versus the other. People feel cramping. And then you've probably heard or seen ads for peripheral artery disease, or PAD. And then there's this phenomenon called claudication, which we're going to talk about in a second. In people, they also get kidney failure. We don't recognize that as its own syndrome in birds, but I have a sneaky suspicion that it does exist, but we just don't have the tools to identify it in our current technology in birds. So let's talk about this thing called claudication. It's a pain, and this is again from the Mayo Clinic website, as is this image, and I copied this directly and pasted it in. It's claudication is a pain in the legs or arms that occurs while walking or using the arms, caused by too little blood flow to that area, the legs or arms. This is usually a symptom of peripheral artery disease, in which the arteries that supply blood to the arms, or usually the legs, are narrowed by these plaques that we talked about on the walls of the arteries. So I thought this was a really nice diagram to kind of show in people and how we can relate this to us, how you could get leg muscle pain because you can see the oxygen's not going to flow through as well. And maybe this leg is going to have a weaker blood pressure or a weaker pulse than this leg is. So I went backwards. I apologize. So the symptoms, what do you think that birds would do if they had, what do you guys think that birds would do if they had a blockage or partial blockage in the arteries of the heart? I just want you guys to think about it for 1 second. If they had what people would call angina, people's heart, they grab, they clutch their heart. Could you imagine a bird maybe picking at that area, picking focally over the heart because it's a little bit uncomfortable and they don't know what's going on? If there's a lesion, and it's not just the brain, it could be any of the blood vessels like in the head and neck that are coming up to there. We're not going to see slurred speech. It's harder to identify loss of vision. But what about these birds that used to be really good talkers and they're just not talking and vocalizing as much anymore? I have a lot of people come in and tell me, yeah, he doesn't really talk anymore. I think he's just getting older. But maybe it's not that they're just getting older. And when we if we identify atherosclerosis and we start treating it, a lot of people say, oh my gosh, he hasn't talked in years. I didn't realize how much he wasn't talking, because it happens so slowly over time. What do you think would happen in the arms and legs? In a bird, they would maybe not be able to use that leg as well. It might cramp up. So let's look at that. What do we see as veterinarians, or you see as owners in birds? Well, these things on the left may be shortness of breath, quiet or decreased activity, maybe changes in appetite. maybe fluid in the abdomen. That's maybe more of a heart disease thing than an atherosclerosis thing, or you might not notice anything. The common things that I see that people tell me they're seeing at home are falling from the perch, a fainting episode, and it's not usually long, maybe clenching one foot or not using one foot as well, this claudication that we talked about, collapse, and it can, in severe cases, it can look like a seizure. And I'm going to let you guys in on something. Even though I put this talk together, the bulk of this talk together a couple of weeks ago, I've been working on it. My own bird decided to have an atherosclerotic episode this past weekend. And she flapped like crazy, which in an unusual spot for her. My dog was crazily barking at her. We thought she was stuck on her cage, but she wasn't. And then she fell to the floor, started vocalizing, threw her head back, clenched her foot. And then what did I do as not the veterinarian, but the bird mom? Oh my God, she's gonna die. And I started crying. So, so it happens to us too. And fortunately for my bird, it was like 20 seconds, maybe 30. And then she started coming around, and probably 5 minutes later, she was climbing up again. And by the next day, she was vocalizing again. But I hadn't, honestly, she was what I would call totally normal, except when I think back, yeah, she falls from her perch sometimes at night. I hear it, I go check on her, she's always fine. So I've always attributed it to like a flashing light or something like by the window at night, or something that startled her at night, but maybe these have been these episodes. So, we veterinarians are human too, and I think it's easy to not recognize some of these early symptoms. And my bird's fine now, by the way. She likes getting her medicine because she gets it on Nutriberries. So what do you see here in both of these birds? These birds have these abnormally clenched feet, and they're both kind of sitting a little bit low. So these are both birds that have had episodes or are having episodes of like claudication. Every now and then the clenching doesn't go away completely when I get the bird on treatment. But if you're noticing this, or I'm noticing it, it is it's almost a hallmark, almost. There's other reasons, but that's why it's so important to get your bird to a vet, even if the episode has resolved. So when you go to the vet, how are we going to confirm the diagnosis? In humans, what they do is they use angiography. They use a multitude of tests, but the most common one is angiography, where they insert a little IV catheter into your femoral artery in the inside of your leg, and then they inject a dye, and they watch that dye move through your heart and vessels, and they look for gaps or narrowing so they can see it real time. We're not quite there yet in birds. So what we have been using, I would tell you, until like maybe 8 or 10 years ago, we had not had any good confirming tests in a live bird. It was always a necropsy diagnosis, but we always suspected it and treated it. Now we have CAT scans, and they are more readily available for birds. And Dr. Eccles, who many of you know, I'm sure, has actually devised a protocol for kind of mimicking an angiogram using CAT scan. And what that is, if any of you are interested, is when we do a CAT scan, the bird goes through the machine 3 times. The first time is what we call a pre-contrast scan. They get a little IV first, a little IV catheter. And then we run them through the machine so we get a good look at everything without any contrast. And then we always want to do a contrast study, which is going to be the post-contrast, where we look at everything afterwards. But what we do that's different when we're looking for atherosclerosis is we do what we call a during contrast administration scan. And so somebody is literally standing there injecting the dye as the bird is running. We inject an IV contrast dye, an iodinated dye. And as we're injecting that, the bird is going through the CAT scan machine. So we're watching the contrast, that dye, as it's moving through the veins and collecting images on the CAT scan. And then the difference between that scan and the post-contrast scan is by the time we do the post-contrast scan, like a minute later, the contrast has already pretty much left the blood vessels, and now it's in all the organs. So that's when we're looking at the organs, we're looking for lesions, we're looking for tumors, we're looking for other things. Okay. So that's the type of scanning that we do. And that's why you really want an avian veterinarian to do your CT scan. Or if you live somewhere remote, maybe you're going to like a scanning facility, talk to an avian veterinarian. Like I have a client that lives in New Mexico. She has a great CAT scan facility available to her, and she's a vet tech, so she has everything available. So I just talked to the CAT scan facility, told them how to do it, and they did the protocols. So that's why you want an avian vet involved in making this diagnosis. If you don't have CAT scan available, you're not completely out of luck, because we have lots of supporting tests that might be abnormal, that might point us in the direction or help support this diagnosis. Blood pressure, I like to look at blood pressure. It's a little bit nuanced. I'll show you that in a second. I like to look at cholesterol and triglycerides, maybe x-rays, and again, cholesterol and triglycerides are that HDL, LDL, and VLD. So here's a picture of us taking a blood pressure in a bird, and this bird was naked for a different reason, and she was getting ready to go into surgery, so she's anesthetized here. I happened to just use her to take, she is not dead, I promise. She's just going into surgery, so I just happened to take pictures of getting blood pressure on her. But it's really just like in human medicine. You get a little cuff that we put around either their leg or their arm, and I use a little Doppler probe, and I blow up the cuff, and then as we deflate it, we listen for the sound of the beating heart. So it's really just like a blood pressure in a person, and we have these normals. And I will tell you, if you start reading about this or you use Google, you'll find some studies that show that these blood pressures don't correlate all that well with what's called an arterial blood pressure, or like the true blood pressure of the bird. And that's okay with me, because what I'm looking for is I'm looking for a trend. Like, am I getting a reading of 250 or 300? And then when I put the bird on treatment, I get a reading of 200. Then I know my treatment's working. So I don't really care if 200 is not the exact value. What I'm looking for is, like, when I did my blood pressure on Gracie, my bird this week, it was 120. So she doesn't have high blood pressure. So I feel pretty confident that she doesn't have high blood pressure at this point in time. So it might help direct my treatments. So that's blood pressure. And it is a little nuanced. I will say I had a lot of trouble getting it on her this week. And I've gotten blood pressures on birds as small as cockatiels, although I can't always. I don't want you to think I'm like this magical person that can always get it on even tiny birds. Okay, we look at cholesterol and triglycerides, because remember we said we know that they're part of the problem. If you were to look at a normal blood sample and let it sit or spin it out, what you would see is, this is just a separator, that this is part of the tube, this isn't part of the blood. What you would see is these red cells, and then you'd see clear serum or plasma in any cell. This is not normal. This is extremely fatty blood. And if I were to shake up this blood tube, it would look like strawberry milkshake instead of blood. And everybody knows what blood looks like. That's a lot of fat in the bloodstream. That's a lot of fat. Can you guys imagine how well the oxygen can be delivered if your blood is that thick and sludgy like a strawberry milkshake? Not very well at all. And that's what this bird had. This bird had atherosclerosis and high cholesterol and triglycerides, very fatty blood in the blood vessels that were supplying the head and neck. And this bird, it was really, really, really bad when it came in. And it came in like this. This is an oxygen cage. I will tell you that after treating this bird, we got him to the point where he could almost hold his head up straight, but not quite. But he could eat and function for a while. So sometimes it's not so much how bad they are, but how well they respond. Cholesterol, this is just like humans. There's 1 or 2 labs in the country that can run different triglyceride cholesterol levels in birds. And we know that HDLs are good. LDL is a bad one that correlates with high cholesterol. And when you have high LDL, this is where you get those deposits, the cholesterol deposits on the walls of the arteries. So that's the one that's most closely linked to arteriosclerosis or atherosclerosis in birds. And then VLDL is the triglyceride part. And that we know, at least in humans, it's greater risk for coronary artery disease, meaning those are the blood vessels that are actually supplying the muscles of the heart. Triglycerides, this slide is not exactly right because they didn't know how to make it exactly right. But the first 2 slides, triglycerides are either synthesized in the liver or absorbed from the diet. So these 2 should be equal. And then they go from the diet or the liver, they get bound to what's called a lipoprotein. then the liver takes them out of the bloodstream, breaks it down into these VLDLs, which are not good. Those are the triglycerides, and then releases them into blood. So the liver is part of that. So remember when we talked about the liver before, you also need like a functioning liver, but sometimes if there's excess fat or triglycerides in the diet, that can lead to increase of the VLDLs and triglycerides in the blood. How do x-rays help us? Remember, we're talking about supporting tests for atherosclerosis right now. Okay. And I do want to point out that not having a high blood pressure, not having high cholesterol and triglycerides, not having x-ray or CT or x-ray changes doesn't mean that your bird doesn't have atherosclerosis. These are just the things that we look for to support the diagnosis. So you looked at a few x-rays before, and this is actually my bird Gracie. This is her x-ray from earlier this week. And the area I want you to focus on, remember we talked about the heart and the blood vessels going back here, the head's over here, arms are up here, legs are down here, this is the tail. I want you to focus on that little area right there, and we're going to blow it up a little bit. And that's that aorta. And you can see there's what I think is an actual plaque that this density that's showing up that really doesn't belong there in the aorta as it's going to the back. So I don't love that, I have to say. This is a different bird, but what I wanted to point out to you on this bird, same view, is remember our x-ray lesson from before. Here's the heart. Do you notice how prominent this is when we're looking at this aorta here? Like you can see it, it's almost like jumping off the page at you, whereas nobody else's really looked like that before. And if I wanted to blow it up for you. I'm trying to back up here. I wanted to blow it up for you. I don't know if I can. The other thing though that I want you to notice is if you'll notice there's like a bright white line right here and maybe right here as well. These might be atherosclerotic lesions because it just shouldn't be that bright, okay? This is another bird that I saw this week. These are films from the referring veterinarian, and this is my bird Gracie. This is not the best view usually. It's that lateral view, the other view that I just showed you, that is better for seeing the great vessels. But this is my bird, and this is the other bird that I saw. And the area I want you to look at is right here. And I hope that you can see a difference. This is that brachiocephalic trunk that we talked about. And can you see how prominent this is compared to this over here? So again, sometimes we see things that are really, really, really suspicious on an x-ray. And it might be that these things are just kind of confirming what our other tests have told us, or it might be that we're using this as a way to monitor progression over time, or it might be that we're taking an x-ray for something else like a broken leg. We see this and we say, we should probably look and investigate that a little further. CT scan is the best. These are some images. These are my scans from one of our patients at my practice, which Dr. Eccles has some really nice magnification software where he can magnify these and really show these atherosclerotic lesions. So they're very, very magnified. But what I want you to look at this image first on the right, because I think you'll get a sense that this is the heart. Remember the pictures that we looked at earlier. And these are the great vessels kind of coming off of there. White is bone, black is air, gray is like muscle vessels. And then this is the dye that you're seeing here, this brighter area. And you can maybe see that this dye is moving through, but then there's this like white area here and there's no dye around it. This is, I think, a different bird, and we're actually really, really, really zoomed in on right here, okay? So this is the end of the trachea, this is the heart, these are the vessels. And if you look, here's the dye going through the vessel, but what do you see right here? You see this narrowing? That's an area of atherosclerotic plaque where the blood is carrying this iodinated contrast that shows up as white, and you can see the blood vessel around it, and you can see that it's not filling the vessel like it should here. And this is a vessel in cross section, just like we looked at on that diagram earlier. And you can see we're able to measure the inside of the vessel. This is like the blood that's flowing, and this right here is a plaque, okay? One more image. This is looking at that lateral view that we talked about on a CAT scan. This is the heart. This is the aorta, the brachiocephalic trunk coming off of it. And you see this right here and this right here. And this right here, this is an atherosclerotic plaque. Okay, so sometimes we can see these things without even any contrast. So this is why CAT scan is so much better. And I don't know how I'm doing on time. We're pretty short on time. So I was going to run a CT through, but I think I'm not going to do that just for the sake of time. And maybe I can do that at the end if we do want to see it. Because we really go through these images in real time, one at a time. Let's talk for a minute about treatment. Treating patients is a combination of modalities. We use medication, diet modification, exercise. Sometimes we use statins. And then when these birds come into me in crisis, oxygen. The medications are directed by the primary disease. So we can use drugs that help the heart muscle, and we use drugs that help decrease vascular resistance. They are human. They're all human drugs. They're all given daily or twice a day. And they may need adjustments in dosages over time. So some of you may already have birds on these medications, so I thought I'd really quickly go through. There are medications that'll help lower blood pressure. Those are isoxaprine, aspirin, and allopurinol, benazepril. These are the ones we commonly use. And we all know aspirin helps also prevent clots. There's one drug that we use that helps make the red blood cells more deformable, and that's called pentoxifylline. And so if you can imagine those red blood cells, which are the ones that carry oxygen, going through those blood vessels, if they can deform more easily, maybe they can pass through those atherosclerotic plaque areas more easily. So it makes the red cells more flexible, and it also helps with the ability to break down clots. And then we also use drugs that are called vasodilators. They dilate the blood vessels. So if we can dilate it, maybe we can open up that blood vessel just a hair, but it opens up and increases the amount of space that the blood can move through. We do have drugs that help the heart itself function. That's called pimobendan, but we don't often use that in atherosclerosis, but we do often recommend using a cardiologist and an echocardiogram to see if there are other issues of the heart. And then maybe using some omega-3 fatty acids. So those are kind of ancillary. Diet modification, eliminate seeds, eliminate salt. It's supposed to say eliminate fats. I forgot a word there. Converting them to pellets if they're not already on pellets, lots of fruits and vegetables, and avoiding vitamin supplementation. Really getting your bird on pellets or even nutriberries, which are like a better combination. Even if they're eating that as their sole diet, it is better than seeds alone, and it's a really nice transition food. There are plenty of other brands of pellets. I wanted to highlight Lafeber because they were so gracious in sponsoring this talk, but there are other brands. I would advise you to stay with a reputable brand and not like Dr. Bob's pelleted mix from your local pet bird store. You really don't want to do that. There's not science behind those. Exercise. What do birds do in the wild all day, every day? They fly, they forage, they climb, they nest, they groom. I got to spend a little bit of time in Peru working with the Scarlet Macaw Project, thanks to Texas A&M. And these are some pictures that one of my client/friends took of birds in the wild, just playing and grooming. I'm not this good of a photographer, but these birds are just playing in the wild. They do same things that our pets do in captivity. So we really want to try and mimic that. We want to encourage activity if you can, and if it's safe, we'd love to see our birds free flying in an aviary room that has lots of toys and lots of enrichment for them that really encourages movement. But I want you to think about not just flight, but wing flapping, foraging activities, climbing, balancing activities, all the things that get your bird moving. Interactive play with you or with other birds. Foraging activities, like I said, things that get the bird to go into different positions, use its limbs, hang, and exercise. How can we prevent it? All the things we already talked about, really. Healthy lifestyle. Remember, we can't change genetics. We can't change whether it's a male or female, but we can have that bird have a healthy lifestyle, avoid them getting obese, keeping them on pellets, fruits, and vegetables, avoiding the high-fat foods like seeds, and getting our birds lots and lots of exercise with active play and flight. So these are some videos Dr. Hoppus has given me just to show, like, this is actually, I think her bird was dancing, but this is what my bird does when I bathe him. When I spray him with water, he loves it. So I get him to, using that as a way to encourage flapping and exercise behavior. Oops, have to advance. These are some foraging behaviors. Giving them foraging boxes and tools. It encourages the bird. This bird's upside down, so it encourages them to kind of change their position, move around, go chase and find different toys. And I just want to give you guys ideas and suggestions for how to get your birds moving. We talked already about interactive play. It doesn't like me. My computer has decided it doesn't like me anymore. Here we go. Come on. Dancing. You already saw that. Birds are dancing. So you just really want to get your birds moving. So just to summarize and wrap it up, these are long-lived species. And as we have better nutrition, better health, better information to get our birds living longer, and better medicine, better technology, we are finding that their atherosclerosis and heart disease is more similar to humans as opposed to like dogs and cats. There's not really a cure. In a person, they would go in and do a balloon angiography or place a stent to replace that damaged blood vessel. We can't do that in birds. I wish we could. So we use treatments that are aimed at improving their quality of life, prolonging life, and improving oxygenation of the tissues. So when I say exercise, I do want to just put in one word of caution, which is that when your bird is really sick, so like, for example, right now, my bird Gracie just had this episode, like, I'm not exercising her right now. I need to get her on her treatments better. And then I want to gradually introduce an exercise program for her. So this is not something that you do when your bird's sick and it's having an episode. You want to work with your vet at when it's appropriate to start exercise. Very much like if I tried to go out and run a marathon, I would probably die right now. So, but if I tried to go out and run a mile, I might make it. But these are the things that we can do. Good diet, good nutrition, lots of exercise, sunlight are the best prevention that we have. So thanks again to Lafeber for sponsoring this. And this was a picture, several of these pictures were provided by Lafeber also as well. Thanks again.
Great. Oh my gosh, that was so informative. I mean, not only just for our birds, but for ourselves, our own like human health. Like, wow. Okay, thank you.
I know it makes you want to go on a diet, right? Like start exercising and get healthy.
Yeah, it makes you want to go and eat a good diet today, a good lunch for my area, like lunchtime here. So eat healthy. Hey, just a quick question for you. I know we had some questions that but I think you answered a lot of these questions in your presentation. You got to like I think you answered a lot of the questions that people were going to be asking. Are there species that you see more often than not that have this, like, or I guess maybe our foodie kind of, the ones who really like to eat parrots? Or
Amazons especially, and I will say Amazons are a species that are really prone to obesity too. They just tend to get really fat. They're like a sedentary, they tend to be less active even in captivity. My Amazon owner's like, yeah, he just hangs down on the perch. He doesn't want to do anything. Well, maybe we need to incorporate like a foraging tree or something for them. So Amazons are the biggie. African grays and macaws, and then the surprise is the Quaker parrots because they are such an active bird and they're small, so they just kind of don't seem to fit. But we're learning that they have a predisposition as well.
wow. Okay. Yeah, we're people want you back, so I'm hoping that you can come back and join us for another webinar. This was this was really good. I mean,
thank you.
Yeah, and the presentation and I mean, it's great that they can go back and watch it so that that we can reabsorb the information. It's such a good presentation you gave. Thank you so much for that. That's awesome. And let's see. So I got to announce today's giveaway winner of the I'm going to get the pumpkin spice Nutriberries as well as a Lafeber product of your bird's choosing. And who is that going out to? Let me see here. Sorry, I have to scroll around here. It's so what do it down to today. Okay, sorry. I have to, we got so many thank yous that I have to scroll up to find the winner announcement. Okay, it is and I apologize if it is Aubrey Traina. I hope I pronounced your last name correctly. So Aubrey, congratulations. And then next Friday we're going to be on with Dr. Tom Tolley for an episode of Ask the Vet. And then we've got our November webinar topics posted on lafeber.com. Just a preview of that. We've got let's see, Dr. Lamb doing the California Condor project updates on that. We're going to have Pamela Clark with part 2 of behavior. And I believe another episode, another Ask the Vet in November. So boy, we really do want you back. Dr. Antinoff. This was really good. Thank you so much.
Thanks,
yeah.
everyone. I'm happy to stick around if there's more questions. I know I went a little over time. I have a tendency to do that, but
well, it's better to, I mean, we appreciate the more information, the over information instead of the under information for sure. Well, let's see. Okay, so Brenda's back with us today, which is great. Brenda, do you want to pull one question that we can ask, and then, I mean, if you don't mind, just because I know that something that might not have been covered in the topic, but you covered so much territory. Here we go. Ready? What does the term inflammation refer to in the context of atherosclerosis? Is buildup in the arteries inflammation, or are the arteries themselves inflamed?
the buildup is the inflammation. Yeah, the buildup itself is the inflammation. And then what happens is it recruits the cholesterol that deposits on the artery wall, basically sends a signal to the body saying, I don't belong here, send the cleanup crew, which is those macrophages and lymphocytes we talked about. So then the cleanup crew comes along, and in the process of cleaning up, those cells rupture, and that creates more inflammation at the site, which says, oh, bring in more recruitments, bring in more of the cleanup crew. So when sometimes when we give a medication like aspirin or meloxicam as an anti-inflammatory, a lot of times people will say to me, well, I don't think he's in pain. Sometimes we're not using it just for pain, but they are anti-inflammatories, and we're using it specifically for that inflammation process that's happening, because we want to combat that.
Okay, and then okay, let's squeeze another one. This one, guys, are so good questions. So are any supplements that might help support a bird with atherosclerosis? Any supplements?
Yes, the omega-3 fatty acids are excellent for humans and people. And I know it sounds a little counterintuitive to actually give a fat, but the omega-3 fatty acids have been shown to help with free radical scavenging in the body. And I believe that some of the nutriberries, the senior berries, actually have the omega-3 fatty acids in them as well.
For sure, yeah. Okay, and just real quick, so in your presentation, I think, did you mention something about vitamins with
We don't want to get too heavy on vitamins. It actually goes into this really complicated cascade with over supplementation with vitamins that can lead to more mineralization of the vessels. So if we get a bird on a good healthy diet with pellets and a lot of variety in fruits and vegetables, then there's no need for vitamin supplementation, and we can get into over supplementation, which can kind of exacerbate the process. So that doesn't mean that you should never give your bird vitamins or minerals. And there might be particular reasons, like if you have a senior bird, your vet might prescribe calcium for a different reason. It doesn't mean that you will never want to give like a vitamin or a mineral, but I would avoid any like vitamin mineral supplements in concurrent with the treatment of atherosclerosis unless they're prescribed by your vet.
Okay. Yeah, and Brenda points out that like all the Lafeber diets, they actually all have omega-3 and or omega-3 and 6 balance. So and the nutriberries, yeah, they offer the extra support. So okay. Well, gosh, yeah, we'd love to have you back if you're available. Whatever we can book you, we would just love to have you back with this.
Thank you. I'm so flattered. Thank you.
Yeah, it's great to see you. And again, thank you for joining us on a Friday. And yeah, I hope to see you back. So,
Okay, thanks so much. Appreciate it.
all right, guys. On that note, I wish everyone a wonderful weekend. All the best to you and your flock. Until next time, stay safe. Bye.
Take care. Bye.